Everyone. I am Wendi Weiss. I'm super excited that you are here on our live stream. I have I've introduced a new podcast called Redefine Yourself during times of crisis, where I am bringing together experts and thought leaders in various different fields. And I have the great honor to introduce our very special guest today, and her name is Elizabeth Lucy. And share a little bit about her background. I know Liz from YouTube, and she has a fabulous channel, and she has been sharing ever since the coronavirus, ever since the pandemic. She's been sharing video updates on COVID-19. And the reason being is her background is public health. So she's a public health specialist who focuses on designing healthcare systems to keep people safe. Really important conversation right now. She's also an epidemiologist, which she studies patterns of disease. And she's over in the UK. So Liz is over in the UK. I'm here in the US, and we're having a global conversation, a global perspective of looking at the coronavirus. So welcome, Liz.
Thank you so much for having me, Wendi. I'm so happy to be here.
Well, thank you so much for being here. I want to go right into this very first question. I know it's a very broad question, but I wanted to ask you about the best practices handling the coronavirus from a global perspective.
Well, it like you say, is obviously a huge topic and question, but there has been some really good practice internationally, and I think it comes down to core principles really, and the countries who've done best in terms of containing the virus and those who have the lowest levels of mortality are the ones who acted quickly. So, and by acting, I don't necessarily mean acting with huge, serious measures really quickly. Even just measures like taking it seriously, contact tracing, and following up contacts. So some really good examples of that would be South Korea. They've done a really good job as soon as they identified that they had cases. So if we just take, for example, their mega church, you might have heard that they had an outbreak in a mega church where 1,000 people got together and the case attack rate was really high, which just means that lots of people who were involved in that got sick. So the authorities took it really seriously. They found everybody who was infected. They tested everybody. They then contact traced everybody who they'd come in contact with. Then they followed up any other contacts that those people had come in contact with. And they basically mapped out a huge web of contacts, followed them, traced them, tracked them, tracked them. And that is one of the most efficient ways to really keep that contained. And Germany similarly, so they saw the seeds of this pandemic really early on. So back in January, when they started getting the data out of China, Germany got together their academics, they got together their pharmaceutical companies, they got their politicians, their government, all of the people who could help and had a role to play in managing a potential disease outbreak. And they got them together really early and they started looking at strategy. And obviously strategy is the most important thing because it gives you that overarching view of every different area that needs to be addressed in order to really contain the spread of that virus. And so they got their testing online really quickly. They got their contact tracers up, trained and ready to go. They got their academics involved. They boosted their lab capacity by using laboratories in universities. And they really got everybody involved and everybody had a role to play and they mobilized that really quickly. So those are some examples of two countries that have done a really good job. And similarly, I would just sort of add from the public health perspective, Singapore is another really good example, because straight away, again, tracing and tracking, but also they were really, really, really good with their public hygiene. So the government employed people to literally go and clean lift buttons and to spray handles in public places. And I was always very impressed with the level of communication from the Singapore government. They sent WhatsApp messages to their citizens. They have now sent every single citizen in Singapore a face mask. And they've been really
Wow.
transparent, really, really transparent. So those are some really good global examples.
That's really incredible. They actually sent to all of the people got a
Yeah,
mask.
yeah,
Yes,
yeah.
incredible.
Mm.
And so how would you say that the US has done in regard, to the rest of the world?
Yeah, I think globally there has been a bit of a lag. So I wouldn't say this was necessarily exclusive to the US, honestly. I would say the UK is very similar as well, where I am. I mean, I've certainly noticed that the month of February for me, I don't know, I think me and I feel like some of my scientific colleagues, we were just sort of sat there in February, sort of aghast at like, can nobody else sort of see what's happening here? We need to get this testing out. We need to start contact tracing. People need to be more aware of this. And it just seemed like the response at government level in lots of places across the globe, including the US, was very sort of slow in reacting to that. And again, it doesn't have to be, we weren't necessarily saying let's lock it down right now in February, but I was certainly saying the epidemiological criteria for testing is too tight, because about viruses spreading. Once a virus is able to spread from person to person, then it doesn't really matter if you've been to China or not, because you could have just been in a supermarket with somebody and been exposed, or you could have just been in work with somebody and been exposed. But that really strict criteria for testing was in place through all of January, all of February, all of March, both in the US and the UK. The USA, before they had given the responsibility to the regional public health departments, only tested at the national level, and they did 426 tests between January and the 24th of February. So it was something ridiculous, like, very, very small number of tests per state. And it was very difficult. The tests didn't work, and the testing was a big problem in the States at the start. Obviously now their numbers are much better. I mean, you've done millions of tests now, which is really good, but at the start, I think that was really, really lacking. And similarly in the UK government here on the 13th of March said, we're just not testing anymore. There's no point. We're moving to a different phase of the strategy. We're not even going to bother to test anymore. And obviously there was a lot of backlash to that, because if you're not testing, how do you know where to target? So I think in terms of the American response, there was definitely some delays, but they're definitely moving forward much quickly now with the testing and with contact tracing, definitely.
Yeah, so true, with those numbers. I'm actually going to bridge into territory with caution as I ask you this question. Like here in the US, the coronavirus has really brought up, surfaced up a lot of the politicking and politics.
Yeah,
And have you
yeah.
seen that? And where have you seen that in other countries?
Yes, well, I personally have definitely noticed that. In fact, that was something that I was just talking about this weekend. When in February, when this was emerging and the data was coming out really rapidly, it felt like everybody was on the same page. Everyone was interested in the science. Everyone was interested in how do we stay safe. And as the months have gone on, it definitely has that much more political sort of connotation now, with a big spectrum of kind of if you believe this, it equals this. So if you think that it's a hoax, you must be a certain political type, or if you think this is real, you must be another certain political supporter. And I don't think that was there at the beginning, but it's definitely something that I'm seeing now. And definitely the challenges for politicizing anything like an infectious disease means that the core of what we need to do can get lost. So we need to protect people and keep people safe. And obviously that needs to be balanced by the overall context of the country, but certainly it's important. The priority should always be keeping people safe and keeping them healthy. So I've definitely noticed that in the sort of American discussions, and the American newspapers often have a comment section, and you can see in there lots of people very, very politicized about it. Internationally, I'm not sure, honestly. I mean, I've seen here in the UK that there is some discussion around general trust, but I think that comes with every kind of big issue. So populations trusting governments. I can't say I've noticed it particularly for one political party or another, just generally about the trust of politicians, and politicians' trustworthiness is something that is obviously becoming more apparent now as well. But in terms of linking that to political stances, I can't say I've particularly noticed it in the UK or abroad. But I will caveat that by saying I am not necessarily the most political person. So it could well be going on around me. And
Yeah,
unless it's really obvious, like the American politicization, it could just go over my head.
that's fair, of course. And in regard to the numbers and the numbers that you have seen, can you comment on the reinfection and potential for reinfection?
Yeah, so this is something that is really interesting to me and something that I'm watching really closely. Now, a couple of weeks ago, the South Koreans published a report saying that they had 116 people who had reported a reinfection. And it was never really clear, and they're still working on this now to establish, was it actually reinfection, or was it that because the virus is so new and we don't know about it, we've seen like waves of illness. So people might get sick for about 2 weeks and then think that they are completely clear for 5 days, and then they get sick again. And what they're considering is it possible that a person is just experiencing the same bout of illness, it's just manifesting in different ways? Or is it that actually this person has recovered and they've been reinfected again? And then that would open up the suggestion to say, well, actually, could that be due to the fact that a person could get sick and create antibodies, but those antibodies don't last very long, which means that a person can then get reinfected again? And that's something that we're exploring really closely as well, because there's been a few studies that have said of the people who have been infected, the spectrum of antibody titer, so the level of antibodies that a person has, and obviously, just in case anyone doesn't know, antibodies are obviously the so it's like immunological memory. So if you get reinfected again, your body will remember that you've already had the illness, and then it'll fight it off really quickly. And what they're saying is that actually that level of antibody is different in different people, or at least this is one study, just one study. And so the wider conclusion is that, is this going to be the same for everybody? Is it going to affect people differently? Could different people have different immunological memory lengths? And how long? At the moment, nobody knows. Best guess. So Dr. Fauci suggested that it could be an immunological memory of 2 to 3 years, because that would be in line with SARS. So SARS has that 2 to 3 year protective effect, but we just don't know. The data isn't there. And the World Health Organization actually put out a report saying that it should all be taken with caution because we don't know. So all of these things like using immunological passports, using antibodies as a way to say you can go back to work now, all of that should be taken with caution, because we just don't know how long you'll be protected for and if reinfection could occur.
Yeah, which leads me into what's going to happen, what's on everybody's mind.
Yeah.
Does it look like the fall, or does it look like it's the end of the year? Like going back to semi-normal to get back. I was just curious what your thoughts on thinking about international travel or restaurants or schools, and what you've already seen now as we're beginning to reopen.
Yeah. I mean, for me personally, this is a long game. So I think if people are sort of expecting that, oh, in next month everything will be completely back to normal, we'll be back on our holidays and the supermarkets will be ram-packed and full of people again, I don't think that we will see that anytime soon. I'm talking at least a year, 18 months. And that's just social distancing. So I think on my channel, I talk about moving from a susceptible population into a protected population. And all that means is that enough of the population are protected so that they can't get sick anymore. And in order to get there, we would need several like interventions. So it could be a vaccine, or it could be natural immunity, or but then that leads us back to that antibody conversation, which is obviously a big question mark. So in order to really protect people, we are definitely going to have to keep some measure of social distancing in place, whether that's just limiting the number of people into a supermarket at any one time. Probably restaurants are likely to be curbside pickups only, with very, very spaced out tables inside if they ever, go back to that model of working. Things like cinemas, that's anyone's guess. I mean, cinemas, schools, places where you can't social distance are going to be very difficult. I don't know what's going to happen with big gatherings and sports events and that kind of thing. I mean, to me, I would say that we're probably looking at least till September, possibly the end of the year, before we start to see any kind of sports gatherings or concerts or in-person things. Lots of the big football associations here in the UK have postponed everything. I think Taylor Swift has even cancelled every single concert for 2020. So lots of people are pulling out of big events over the rest of this year. Going into 2021, I guess it just depends on any kind of pharmaceutical interventions. I think the thing is, if we can treat people in hospital, because people are going to get sick regardless. So if we've got the capacity to treat them, and if we've got therapeutics to support them, and potential ways of protecting people ongoing, it could move back faster. It just depends what comes out, what we learn about the virus, and what methods of protecting ourselves we find.
Yeah.
Sorry, it's not very specific, really, is it?
Well, it's helpful though to always think about, expect the best, but have a plan in place. Have a plan and patience, and yeah, just keep preparing for a long game,
Yeah,
and what that strategy looks like for you, your family, your kids, your career, your employment, as people are redefining themselves, and what
yeah,
the possibilities are. And there's a lot of creativity coming out
yeah,
right now, and that's exciting, to see the innovation. And we're going to see a lot more of that. Well, thank you
definitely.
so much. You've shared a wealth of information. For anyone
My
who's
pleasure.
watching, I invite you to join Lucy over on her channel. And we'd love to have you on again. Thank you so much, everyone. And thank you so much, Elizabeth.
Oh, it's my absolute pleasure. Thank you so much for having me, Wendy. Stay safe, everybody.
Now, stay safe and be well.
Thank you.